Yeah, I'm Dr. Vikram Huded, Senior Consultant Interventional Neurologist, Narayana Health City, Bangalore. Today I will be talking about stroke. Stroke is one of the leading cause of mortality and morbidity. According to World Health Organization, 1 in 4 people will have stroke in their lifetime. Good news is it is a preventable disease and a treatable condition. Stroke happens because the blood flow to the brain is blocked and there will be damage to the nerves. So this is called ischemic stroke. Majority of stroke are because of ischemic stroke, which is around 80% of patients. And if there is any bleeding inside the brain because of the rupture of blood vessel, it is called hemorrhagic stroke. Around 20% of stroke are due to hemorrhagic stroke. It is important for people to recognize the symptom of stroke. Please remember the mnemonic: be fast. B for balance issue, E for eye vision, either blurring vision or double vision, F for facial asymmetry, A for arm weakness, S for speech disturbance, and T for time to rush to stroke ready hospital. So if you see someone having these symptoms, it is important that you should rush to stroke ready hospital, because if in stroke ready hospital all the process is done faster, and if we see that the blood flow to the brain is blocked, if you come within 4.5 hours, there is an injection, clot buster injection, which we can give to open the vessel. Or in some cases, if there is a large vessel occlusion, up to 6 hours time, we can go inside the artery. From the leg artery, we put a small tube and to go inside the brain, and we remove the clot out. Recently, these procedures, the clot removal can be done up to 24 hours time. That can be done only in few cases. For that, we require good imaging facility. We have an automated software for that to identify which patients we can do thrombectomy. So, and we can also prevent the stroke by evaluating the patients in routine patients who are at risk for stroke by doing carotid Doppler. If there is any blockage, we can give medications and we can do surgery or we can do stenting. These things we do for the ischemic stroke. Now coming to a hemorrhagic stroke. In hemorrhagic stroke, there will be severe headache and vomiting, and some patients lose consciousness. Majority of intracerebral hemorrhage or brain hemorrhage is because of the high blood pressure. But there is a small entity called brain aneurysm, where the artery to the brain is swollen like a balloon, and it can rupture, causing intracerebral hemorrhage or brain hemorrhage. It is a serious condition. According to American study, 1 in 50 will have brain aneurysm. So usually it is not diagnosed early. Once it ruptures only, it is diagnosed. Okay, once it is diagnosed, if there is an aneurysm, we in intervention, we do minimal invasive procedure where we put a small tube from the leg artery inside the aneurysm, and we can put coils. If it is unruptured or wide neck, we can even put a flow diverter stent. In some cases, we do stent-assisted coiling. And if there is a AVM or dural fistula, we can do embolization, which is a minimally invasive procedure. Thank you.